I couldn't find them. I searched.
Okay, Board Member Carroll,
Here.
Board Member Kaplansky. Board Member Kaplansky, can you hear me?
You might be muted.
Brian Kaplansky? I know he's here. Board Member Skinner is excused. Board Member Rastetter is excused. Board Member Machuru is excused. Director Boshain,
Here.
Mayor Kearns excused. Commissioner Manzola,
I'm here.
and Chair Harble.
Present. I looked through the minutes from August 27th meeting and I didn't see any issues with it. I would move to approve.
I'll second.
All in favor?
Aye.
Aye. Brian's audio's not beyond.
Yeah, I see him twice. One is muted and one is not.
Did anyone message him?
Here, Alice.
I don't know if his audio must not be working either or.
I'm not sure what's, I'm messaging.
Okay.
I haven't got a response yet.
Well, we will come back to that, maybe approve it later in the meeting then. Joe, I'll just open it up to you and have you start giving us a review.
Hey, thank you very much. Good evening, members of the board. Appreciate the opportunity to be with you again this evening. I think we're going to start with a COVID-19 update, and I know under new business, we have a kind of special presentation from our staff who joined us, so looking forward to that. But let me just really briefly kind of give you a summary of where we are with COVID-19. As you probably have seen in the media and with other updates from the health department, we certainly are trending in the wrong direction. Our average number of new cases within our health jurisdiction, again, outside of Columbus and Worthington, but in our health jurisdiction, over the last week has trended anywhere between 60 new cases to now over 80 new cases per day within our health jurisdiction. This comes after a nice steady decline over the course of September, where we had kind of we're right around 35 to 40 new cases per day. And over the last 2 to 3 weeks, we have certainly been trending upwards, as the state has as well. So clearly that's of concern to us. Related to that, our hospitalization numbers, though stable in Franklin County as a region, have increased significantly since we last met. So that, of course, is of concern that will translate into higher hospitalizations here in Franklin County. We've talked to our chief medical officers for the 4 hospital systems here in Central Ohio, and their census counts have been increasing, but nothing that they can't handle at this point, and certainly not at the rate that we're seeing across Central Ohio and across the state of Ohio as well. So we have, there's reason to be concerned as we kind of get into the fall. Obviously, not only with the flu season here, but with the colder weather, more and more individuals will be gathering indoors, which of course is will put more folks at risk. So we've been kind of shifting our message at the health department to really make sure that we're communicating a message that will, as we have been a little bit of fatigue as far as COVID-19's messages are concerned, we really want to make sure that we continue to send the message that, now is the time to really not to become complacent, and to really make sure that we are taking all the necessary steps to protect ourselves and others from the virus. We've launched a couple of new campaigns over the last couple of weeks that I wanted to just highlight. One is called Spread Love, Not COVID. It's a new campaign that's designed to reach 20 to 30-year-olds. That is the age demographic that continues to lead in terms of the number of new cases that we're seeing here in Franklin County. And it's really a message of empowerment and engagement that we hope will resonate with that particular age demographic. We have radio ads already in play, and we're doing some online social media posts as well. So that'll be a campaign that we hope will get the word out to that particular demographic. And then also this week, we launched a new campaign as we approach Election Day, making sure that our residents take the necessary steps to keep themselves and others safe while they make arrangements to go and vote. So that campaign launched earlier in the week. That's funded by the Franklin County Board of Commissioners office. And you'll see billboards across Franklin County. You'll see social media. You'll see digital. You'll see radio, or you'll hear radio, and you'll see television ads between now and November 3rd. So that's actually a fairly significant media campaign that we hope will, again, resonate as we get into November. So, you know, I think my message to the board and to our community right now is a word of caution. We're very concerned about the trends that are starting to emerge here in Franklin County. We continue to be, the governor announced today, we are a level 3, or that red level, as far as the public health advisory system. And so obviously what's keeping us there is new cases that we're seeing every day, as well as emergency department visits and outpatient visits related to COVID-19 symptoms. Again, our hospitalizations have not moved in a place that would put us into purple. But we do have 3 counties across the state of Ohio that are now on that purple watch list, Cuyahoga, Clark, and Hamilton counties. So, you know, we, of course, we're going to continue to do everything that we can to not only communicate some of those core messages, but our team obviously has worked tirelessly in terms of contact tracing and case investigation, as well as enforcement as well. So I wanted to also mention to the board that we're posting, in addition to our weekly conference calls that we have on Thursday mornings at 10 a.m., we do post notes for those calls. We're also doing a weekly summary, kind of a short summary of kind of where we are as a community, which we post online in the afternoons. And then we're also posting monthly a more comprehensive report for the health department as it relates to our response to COVID-19. And all of that can be found on our COVID webpage. So that's kind of the high-level summary of where we are with COVID. I'm happy to answer any questions that the board may have.
Hey, Joe, this is Mitch. With the other 2 larger city counties going up, do they anticipate that Franklin County will likely be there? Is it just too much of an unknown, really, at this point to try to predict what would happen with the universities and the colleges being in session and schools being in session and the holidays coming? They think that's likely.
In terms of us moving to that watch list for purple, that level 4?
Yeah.
Yeah, probably a little too early to say. But again, you know, I think we can take a little bit of comfort in that our hospitalizations aren't increasing as much as the other parts of the state. It could be just a matter of time before that happens. Of course, we're going to keep a close eye on that. I think some good news from our university partners. I think Ohio State's done a remarkable job. You know, what they've done on campus. In our health jurisdiction at Capital University in Otterbein, they too have taken a lot of good steps to make sure that they are being careful as far as the transmission of the virus on campus. It's really what's really driving a lot of this is really more of those social interactions, those more informal gatherings that we're seeing across our community. And so a lot of family gatherings, a lot of, you know, informal gatherings with friends. You know, we're seeing a lot of transmission of the virus in those settings as opposed to more of the formal gatherings like in schools and workplaces and so forth, which is still occurring, but not to the degree that we're seeing out in the community. So again, I think, you know, I'm very, really my word right now is caution. I think, you know, we have to be very cautious about even the most simplest of interactions with our friends and family, and really kind of rethink, you know, how we're going to be, you know, hosting holiday gatherings here coming up. We have Thanksgiving, of course, Halloween is next week. Just exercising additional caution as we kind of get into the late fall.
Just to interrupt for one moment, Brian Kaplansky's having trouble with his audio, so he's working on it now to phone in. So if we can hold off on voting items just to see if he can get that figured out.
Yeah, that's fine. Joe, what is because I was thinking about the holidays, and we tend to be comfortable around family, and we see family even if we're not with them or quarantining with them directly. A lot of families live, a few hours apart, other cities. But when we get with them, we tend to be more casual, more affectionate. What's the advice? I mean, because families, especially if you have young kids and grandparents, that's where uh, some things can really turn wrong. But what's the Board of Health advice? I mean, what do we say? Because I know we were talking about this with my mom and my brother, who live about an hour away from us, and we've seen them, but it's all been outside at soccer games, football, and things like that. So what would you say is the best way? Is there anything new other than wearing the mask, wash the hands, um, you know, uh, to do while if you are inside going to celebrate or have meetings or family gatherings?
Well, I think what I'd say is that, this year Thanksgiving is going to look a little different. This year, those kind of football parties, if you will, should look a lot different than they typically would. And really, my message is that maybe this year we need to skip some of those interactions, unfortunately. And if you do decide to gather, to really go into those kinds of interactions with the understanding that anyone within that room could be positive. And so, when you're with family, it's not the most natural thing to put your mask on and keep distance and all of that. But that's the kind of advice that we would be giving right now, is that we have to treat those interactions the same way that we would treat going to the grocery store, the same way that we would treat going to work, the same way that we would treat going to school, because we're just seeing too much transmission happening in those informal settings. And so as we prepare for things like Thanksgiving and some other activities, I think we have to rethink how that's going to look. And perhaps, I'm not saying cancel Thanksgiving. I'm just saying I think it needs to, really think through who's going to be there, how many people will be there. Do you have enough spacing for individuals? How long of a duration will you be there? Are you going to wear your mask the whole time? Really just taking those extra precautions and being thoughtful and cautious about how those gatherings come together.
And what about handing out candy at Halloween? Have you guys made any recommendations or given any ideas about actually how to disperse the candy?
Yes, we have. We've offered some recommendations for Halloween that's posted on our website. I can put the link. We have a chat feature here, which I think we do. If not, I can send a link over to. Yeah, here it is. I'll put the link to the Halloween guidance in the chat box there, so you have it.
Okay.
But there's a lot there in terms of both for the kids who are going out trick or treating, as well as the treat givers, if you will, those who are giving out Halloween candy. So lots of good guidance there as well.
Okay, thanks.
So I do have a quick question. I understand how testing is going at Ohio State right now. And when you look at like national numbers, Ohio State seems to be one of the higher ranked colleges in terms of number of COVID cases. Is that because they're more aggressive with their testing, and which drives their numbers up, or is the testing policy sort of standard throughout the universities?
I don't know the answer to that, comparing the university testing protocol to other similar sized universities. I think Ohio State's been extremely aggressive with their testing, which is, I think, certainly has been one of the strategies that has led to their low positivity rate, and really their ability to have campus continue to remain open. But I don't know the specifics in terms of how they compare to other universities.
Okay. I just know I have quite a few friends who have children who are in quarantine because they tested positive, and I'm just curious if how that relates to the general public. It just, if that many kids are not symptomatic and are testing positive, when you look at the bigger picture, it's probably what's happening around us, and I don't know that people understand how that then correlates to like what you're talking about. Eliminate be mindful of social gatherings and so forth. And I don't know how to pinpoint that one topic or, you know, that point to more people.
Yeah, I think it's difficult, but I think what we're seeing with cases associated with Ohio State, or even cases associated with K through 12, the transmission isn't necessarily happening on campus in the classroom, or even in the dorm settings. I think they've done a really good job there. The cases are happening in those more social gatherings, where individuals aren't in that more structured environment. So. Yeah, I think it's a great question. I'm happy to follow up with you with a little bit more information. But it's certainly one of those questions that I think that we're interested in learning more about. And again, our two university partners, Otterbein and Capital, have done all the right things in terms of making sure that their campuses are as safe as possible.
Tess, I think there's another one that we can talk to. I don't think, Brian, are you able to hear?
Yep, I hear you guys.
Okay. Anything else then around COVID? We can move on to the bonus updates and continue through the agenda. Anything else? Okay.
Nothing more other than to continue to ask the board and the city for their continued, engagement to help get the word out about kind of where we are. And again, I'll put some more links in the chat for your reference as you're able to share that.
Yeah, absolutely.
I was going to ask, prior to moving on to the next topic, Brian, do you want to state for the record your vote for the minutes, aye or nay?
Aye.
Thank you.
So those will be approved. Okay, Joe, next item.
Okay, so I do have an environmental health update. I'm going to quickly go through that, but I do want to yield my time to two of our guests here this evening from the health department. Really appreciate both Charlie Brochard, who is our environmental health division manager, and Sarah Fink, who works with our vector control program to kind of give an overview of our mosquito program for the year. But then just going to quickly go through our environmental health report for Grandview Heights over the last couple of months. Really nothing out of the ordinary, but just a couple of quick highlights. We did have an incident on August 25th where we had a potential animal bite with a bat. We were able to test the animal. It was negative for rabies, but that did happen on August 25th. As far as our food safety program, 14 standard inspections, 1 follow-up, 4 complaints, all were investigated accordingly, and nothing out of the ordinary there. Plumbing and medical gas, we had 53 residential inspections and 36 commercial. And then nothing in terms of any public health nuisance complaints over the last couple of months. So pretty standard report. I'll make sure that I get this over to Megan and to all of you for your reference. But I do want to turn the call over to Charlie. Again, Charlie is one of our assistant division managers in environmental health. And Charlie and Sarah are going to kind of give an overview of where we are with our mosquito program, which is, of course, related to environmental health. So Charlie, if you're there, go ahead.
Great. Can you guys hear me?
Yes.
Okay. Well, very good. Well, thank you for the opportunity this evening to do this. We sometimes do this to groups so that they just understand a little bit more about our program. It's a little complex as far as the whole process of mosquito management. And I also just want to ensure that we're kind of bridging the gap between we communicate with the city frequently throughout the season, but then we have these standalone boards that I think we need to communicate just as frequently to them. So we wanted to make sure that we kind of bridge that gap, and it gives us an opportunity to, I think, educate everybody on the program, give us an idea or show you guys how extensive I think it is, but then also open it up for some questions and anything that has to do with the program and our services that we provide to you. Just as a real quick background, Sarah's She works as the coordinator for the vector control program. Background, the way that this whole system is set up is that we're like the administrators of the program. We have 37 jurisdictions that participate with us. It's designed for all 37 jurisdictions. And what we do is we administer the program, but we contract out day-to-day operations and services. We bid these out on a routine basis. Our current provider is Clark Mosquito Control. They're based out of Illinois. So they've been under contract. We have a 3-year contract with them. So it's an interesting private-public partnership. We've been doing this since about 2006. It continues to grow, and we continue to learn through this process. So that's a little bit of the background. I'm going to let Sarah do the lion's share of this presentation. She has learned this program inside and out, and she knows almost more than I do at this point. So I want to give her kudos and credit. And she's going to walk you through a PowerPoint that kind of shows our program and what we do for you guys.
Well, thanks, Charlie. Can everyone hear me okay?
Yes.
Okay, super. Well, the good news about mosquitoes, unlike COVID, we are approaching the end of mosquito season, thankfully. I think we just need about one more frost to knock them all out. I know everyone's been dealing with big crane flies recently, but hopefully you are not having many mosquito issues this late in the year. I did just want to start with a little basic mosquito 101 super quickly, because I think there's a lot of things about mosquitoes people don't understand that's really important to how we approach the control of them. So Ohio actually has between 40 to 60 species of mosquitoes. The life cycle is roughly the same, but they all have different preference of different kind of habitats, where they like to lay their eggs, how they lay them, and then what kind of water they prefer, and once they're adults, where they like to live and who they like to bite. The most common mosquito-borne diseases in Ohio include West Nile virus and also La Crosse encephalitis. And all the arboviruses, those are all viral illnesses that can be locally acquired in Ohio, follow the enzootic disease cycle, meaning that there's an animal like host reservoir. And thankfully, these diseases can't be passed from human to human or even from a mosquito biting a human and then biting another human. So at least we have that in our favor. It makes transmission a little less likely to happen. So our program is built on the principles of integrated pest management. And I'm sorry to give you a lot of background information, but there's not a lot of mosquito programs in the area that kind of follow these principles, and people aren't used to them, I think. So integrated pest management, IPM, is a comprehensive approach to controlling pests, and it emphasizes controlling them at their most vulnerable stage while also minimizing hazards to the environment. So other species and also just ecological hazards as well, and pollution and such. So some of our basic principles are going to be to set action thresholds before we apply pesticides, monitor and identify the pest, what we're dealing with, take measures to prevent the pest from becoming a threat, and then employ control measures. I also have these kind of broken down. So NACCHO, the National Association for County and City Health Officials, they've kind of broken it down to these nice core capabilities, taking information from both CDC, EPA, and the American Mosquito Control Association. And we really strive to kind of hit all of these control capabilities and be proficient in these. They've done surveys, and I think 84% of mosquito programs across the country aren't proficient in these. So we're pretty proud of that. We do try our best. So yeah, it all, as you can see on the screen, surveillance is huge, which I'll talk about. Making decisions, database decisions, doing activities to actually control those mosquitoes, and then making sure that those control actions are working by testing for pesticide resistance. They also have supplemental capabilities. We are thankfully proficient in all of these as well. We're licensed applicators. We're looking at things like source reduction, getting scrap tires out of the environment. community outreach. We are the health department, so it's easy for us to communicate. And then outreach with nearby programs. We do work with Columbus pretty closely. So surveillance, we set over 150 traps throughout the county, starting in mid-May through the end of September. We set 3 types of traps. We set one of each in Grandview. Grandview has its own mosquito zone that includes Marble Cliff. The 3 types of traps, we have a gravid trap. It's that guy up there. That's the one that attracts the killer mosquito, which is the species that can transmit West Nile. So that's the trap that we use to catch those mosquitoes and then test them. We also have a CDC light trap. That trap uses carbon dioxide and a light to attract all different kinds of species. So it gives us a really good idea of what all species are in the area, numbers. It also provides us with data when we make those decisions about controlling floodwater and nuisance mosquitoes, because we do look at things other than just, are they carrying West Nile? And our last trap is purely surveillance. It's the BG Sentinel trap, and it traps invasive Aedes species, such as Aedes aegypti or Aedes albopictus, the Asian tiger mosquito. Those guys can spread really pretty nasty diseases, like dengue, chikungunya, Zika. We don't have those in our population currently, so they're not, while we do have Aedes albopictus, they're not transmitting those actively in Ohio. Thankfully, do not have Aedes aegypti in this area. I apologize if you can hear my dog drinking in the background. Yeah, we do not currently have Aedes aegypti in our area, but albopictus moved in within the past 10 years. So we are always kind of keeping an eye on that as our climate continues to change, habitat changes, people keep moving around. Aegypti is kind of the really bad guy that's responsible for a lot of illness throughout the world. So after we trap those mosquitoes each week, we bring them back to our lab, we count them, we identify what species they are, and then those QLX mosquitoes, we test them in-house for West Nile virus. We get same-day results. This was really huge this year. Usually the Ohio Department of Health, they test mosquitoes for us, like the ones we're not able to test, any extra ones. ODH had to completely cut that program this year. So we were only one of 2 mosquito programs in the state that were actually able to get West Nile data. Okay, so after we know what we're dealing with, controlling mosquitoes, that's what everyone really cares about. Again, talking about integrated pest management, taking them at their most vulnerable stage, the best strategy is prevention. So that's going to be reducing water sources. A lot of that is going to be through public education, bringing those backyard sources to people's attention. Sometimes we need to be a little more aggressive. We got a grant to the EPA this year to collect scrap tires throughout the county. I know at this point we've collected over 1,000, and it's been pretty successful. Tires breed mosquitoes like crazy. So our next step to controlling mosquitoes, if we can't, sometimes we can't avoid that standing water. If it's a flooded yard, a catch basin, or if you're purposely trying to collect water like a rain barrel, we want to try to kill the mosquito when they're in the larval stages before they hatch as adults. That's a lot more effective. It's a lot easier to have a higher efficacy. It also doesn't really harm many non-target species. It might affect 1 or 2 midge species, but it's not going to hurt your pollinators. It's just the bacteria that is very specific to mosquitoes, thankfully. So we also, a big part of our program is treating catch basins, storm drains throughout the county. We treated, I believe, 94 in Grandview, and we've treated over 6,500 throughout the county. We'll also come and treat people's, when we find flooded areas like fields, yards, ditches, we also treat those. You'll see on the left there, the mosquito dunks. That's how you find it packaged if you go to Home Depot. We just use a similar product. So our next step, sometimes, we miss the standing water. It's a source we didn't see or we can't get to. And that's where spraying by truck becomes really important. It's the most visible part of our program. I think it's the only part of our program that people know about, really. But it's actually, I would say, probably the least effective at actually killing mosquitoes. But it is necessary to do at times just to knock down those numbers, especially when they're carrying diseases. So we call our spray adulticides because it targets the adult mosquitoes. The products are designed and our sprayers are calibrated for teeny tiny droplets. We're talking about like 30 microns. It's not going to kill any insects much bigger than a mosquito. And it's only going to kill anything that it comes into contact with. That mist, it only hangs in the air for about 10 to 15 minutes tops. So we're only going to kill the mosquitoes that are flying in that area. Our sprayers have a swath about 150 feet on each side. So we're not, we're getting a good portion of where people live, but we aren't able to get everywhere with a truck from roads, unfortunately. We do also intentionally only spray after sunset so that we are not spraying when bees and other pollinators and other beneficial insects are out. The products do start to break down immediately as they're sprayed. Most of them that we use have a half-life between like 4 to 8 hours and break down super quick in sunlight. So there's really not a residual effect. So we're not seeing much harm to our pollinators that come out that next morning in our foraging. So I mentioned before having set action thresholds. For our disease prevention part of the program, that's if we're finding West Nile positive mosquitoes from our tests, or if we're just finding excessive numbers of Culex mosquitoes. The concern there is if we have just hundreds and hundreds of these that we've caught, and there's a lot in the area, if a bird that was infected with West Nile, because they are the reservoir for West Nile, if they fly into the area, there's all of a sudden a lot of mosquitoes that could bite that bird and potentially become infected. So sometimes we try to get ahead of it when we're seeing those numbers really, really high. And then for our floodwater nuisance program, our threshold is 50 or more mosquitoes caught in a night in that CDC trap. And then after we spray, we always set a post-spray trap the next night in the zone we sprayed, and then also a nearby zone that wasn't sprayed, just to measure our effectiveness. That's kind of a very quick way to look, for pesticide resistance, and just making sure that we are using the right rate and the right product. So speaking of pesticide resistance, in the past, it was kind of thing that was blown off in our region because we're not spraying as much as, say, programs in Florida or Southern California, but it is a growing concern. There has been the CDC funded Centers of Excellence for vector-borne disease, and they have been doing pretty extensive insecticide resistance testing. And it turns out throughout the Midwest, we do have some populations that are beginning to see resistance to the most common products that we do use. Other industries, farmers, yard care, agriculture use the same active ingredients that we do. So it's not necessarily always we're spraying too much. It's just that combination of factors that we need to be aware of. So a lot of times when people are asking about our program or concern, they're asking, why aren't we just spraying every 2 weeks? That's what I was used to when I grew up, or that's what this community does. Why don't we just, isn't that easier instead of doing all this trapping work and all this? So spraying on a schedule or when it's not necessary, if there's not a lot of mosquitoes in the area, it can contribute to resistance because it's going to select artificially those resistant mosquitoes, and then those mosquitoes are just going to reproduce, and all of a sudden you have all resistant mosquitoes. That's what they saw in Florida when they were trying to control Zika a few years ago, and they didn't realize that until after they had tried to control them, which is not good. And some of the resistance mechanisms that mosquitoes can evolve, it gives them resistance to entire classes of insecticides. And so that can leave you with very few options for control and maybe some undesirable ones. You might have to use a really older product like organophosphates that are not as environmentally friendly. We started doing a little more extensive resistance testing in the past 2 years. We've started to see a few resistant mosquitoes in, we do bottle bioassays, as you can see in the pictures down below. Just a few, not enough to suggest that our population is still in the susceptible range, but it is something that we need to keep an eye on. I had an intern from Ohio State who did a project. He tested mosquitoes from nearby areas too. There is a village to the west of us that sprays on a schedule, and they use an older style of product, and over 40% of those mosquitoes were resistant to that product, which is concerning. You know, we don't want to see that nearby. We don't want to see that anywhere. So it is something that we do need to monitor. A few other challenges to spraying, why it's, you know, maybe not always the most effective, and why we need to employ these other control methods earlier in the process. So spraying does not kill species that aren't active at night. So the Asian tiger mosquito is the tiny black and white one that is super annoying. It usually bites you in the early evening. It'll come and bite you like 5 times in a row. It's got a really annoying habit of doing that. They're not active as much as night. They're attacking you earlier in the day because humans are their favorite food. So they're not going to be out at night when we're spraying. So unfortunately, we're not super effective at killing those. We certainly don't want to bump up that spray time though, because that we don't want to wipe out pollinators. We also don't want to spray people who are outside enjoying their days. Some other challenges we see, we're having an increasing number of residents requesting that we not spray their property, you know, which we understand at this time we're still allowing residents to request that for any reason. I did just want to display though, we've had, been seeing an uptick. We had 16 do not spray requests from Grandview citizens this year, and I provided on the slide, there's a our post-spray map. The green dots are where the sprayer was on, red dots are where they are off. Those little green dots, it's like a sprayer crossed out, that's where we have do not sprays requested. And as you can see, when we get a cluster of those, that can make it really hard to get control of those mosquitoes in that area. We have 1 or 2 small areas where we're not spraying half the streets, because we do give people a 150-foot buffer on the edge of their property. And I think some of that is just, we need to, you know, I think we need to do a better job of educating people about what products we're using. I think people still think back to the days of DDT or organophosphates, some of these stuff that persist in the environment for a long time. Sometimes we're using natural pyrethrum, which is extracted from chrysanthemum flowers. So we're spraying flower juice when you break it down. But yeah, I think we just need to do a better part on educating people so they really know all the facts before they just make that knee jerk, like, I don't want any pesticides near my house. Another big part of our program is public education and outreach. We've done events at like metro parks and health fairs in the past. Unfortunately, we were unable to do those this year, but we were trying to have a pretty active social media presence. We have a social media toolkit that's available to our jurisdictions. Just trying to be timely with those two. Like after a rain, you should probably, you know, check all the buckets and bird baths in your yard, that kind of stuff. Okay, so moving on to what we saw in Grandview this year. So our numbers were pretty low in our traps. You know, sometimes, unfortunately, our high traps grab all of our attention, and the lower traps we don't think about as much. And I'm very glad that someone, at least someone at within your meeting, you know, asked about West Nile, and I know a few people at the city reached out to me about it. And just to be sure, we set some extra traps in different areas of the city, which I'll talk about in a second. And we did find West Nile at that point. We do post all this trap data on our website throughout the season. I try to get it updated the day that the traps come back, just so that the public can be informed about what we are seeing in their areas. So one important lesson we learned this year in Grandview is really just how much that trap location matters, especially since we're making all of our decisions based on it. This year was really tricky picking trap locations because we do that in the spring. And this spring, I wasn't really advised to be knocking door to door and just approaching strangers in their home. So we sent out letters instead of observing sites. And without thinking about it too much, both of our traps locations, the green push pin is where the Gravit trap is that tests for West Nile. The blue is the CDC light trap, and the PG trap. I didn't think about it too much, but they're both more uphill. We also didn't get many service requests in from Grandview. You'll see those 3 little green dots. Those are the only complaints we had in the area. So we just unfortunately kind of thought, lucked out we're not having many issues in Grandview with these mosquitoes. People aren't complaining. I think, it was a little drier this year than the past years. So, I think we just don't have a lot of mosquitoes. And then when we set those extra traps, we set them further down in elevation at Pierce Field and the community gardens. That's about 80 to 90 feet lower in elevation than where our trap was. We caught many more mosquitoes and they tested positive. So I think that's our takeaway for next year is we're going to target these traps more in our lower elevation areas. And that's, just in terms of standing water, when the water is draining, those areas are going to be a little soggier, probably breed more mosquitoes. We just want to make sure that we're protecting the most vulnerable areas of the city. So other services we performed this year, I mentioned the 3 service requests. We treated 94 catch basins. We had the one spray treatment based on the West Nile positive. That was in September. It seems a little counterintuitive. West Nile virus is actually the worst at the end of the summer. It amplifies throughout the summer in the bird host. More and more birds get infected as mosquitoes bite them, then they bite more birds, more mosquitoes get infected. So usually by the end of the year is when we start seeing human cases, we start seeing more positive mosquitoes. And also people kind of start to forget about mosquitoes that late, especially as they, in normal years, go back to school, go back to fall activities, and aren't thinking about putting on DEET and other things. So how residents can help us improve and control mosquitoes, removing sources of standing water on their properties. Unfortunately, a lot of times it's something small like a bird bath, clogged gutters, a bucket that are breeding a ton of mosquitoes. They only require about a teaspoon of water for some species. Submitting service requests when they have an issue. It helps us find sources of breeding to treat. It helps us pick the best trap locations then, because we want to be setting those traps in areas where we have issues. It also provides residents with some relief. We will, if deemed appropriate for the property, we'll go through and spray a barrier treatment that will protect the property from adult mosquitoes. It has a residual effect. We are only doing that on private property where we have permission, and being careful to make sure we're not spraying blooming plants where pollinators might be. And yeah, I was kind of surprised. We had a record-breaking year in service requests, and we only had 3 of those coming from Grandview. The last way that people can help is taking personal protective measures to prevent mosquito bites. As much as we try to control the population, there are some that we miss. So just, wearing repellent, wearing long sleeves, loose pants, light colors, all those little things go a far way for people to protect themselves. So that's about all I had. I wanted to open up to any questions. I also work with rats and ticks. If you have any questions about those too, I'm here for you.
This is Mitch Harville. Nothing really about mosquitoes. That was very informative. Appreciate it, Sarah. Right, Sarah? And having that. The ticks, I noticed early in the season, I know we were going to the parks and things more. I noticed early in the season, ticks were really bad. We had friends went camping. I think he found 22 on their dog when they got back. Was there a reason why ticks, was that something seen around the state, or was that something more in Central Ohio as far as the tick count, or is that just kind of a random thing? I know we saw some weird parks up in Dublin and different things too.
Yeah, so ticks are kind of strange. They can be very focal in some areas instead of like mosquitoes kind of spreading out all over. Just they lay like 1,000 eggs at a time. So you can have a very intensely concentrated area of ticks where all of a sudden you are getting like 20 attached. But we are seeing increases in the species and the distribution of ticks in Ohio. The deer tick that is the vector for Lyme disease, we have seen them just almost, unfortunately, kind of exploding across the state. We've watched this pattern in Pennsylvania as the tick continues to move west. And we're seeing that in the western parts of the state. We're seeing tons of these ticks, and we're seeing them in Franklin County now. The state actually just finished a study with the CDC, and we're finding that a lot of these ticks are infected with Lyme. So we are seeing an increase. I think it's kind of bigger patterns with like more deer in the area, also some climate changes, and they're just kind of a successful species. You know, they live through the winter. They actually live a couple years. And we're seeing new ticks to the area too, besides the deer tick. We're seeing the Lone Star tick moved in a while ago. The Gulf Coast tick is now in our area as well. And the exotic Asian longhorn tick is also in Ohio. So we have been growing our tick surveillance program. We actually dragged 2 of the parks in Grandview earlier this month. In the fall, most people don't think of ticks in the fall, but this is actually kind of prime season for the adult deer ticks. We did not find any deer ticks, thankfully. We found a lot of larva rabbit ticks, which rabbit ticks don't attach to humans, thankfully. So it shouldn't be causing a problem to residents enjoying their neighborhood parks. But maybe you have a pet rabbit, not take it for a walk.
Can dogs get Lyme disease? Can they get some of the diseases that ticks pass along, or?
Yes, they can. So I know actually a lot of vets now are testing for Lyme and ehrlichiosis, which can be spread by the Lone Star tick. Yeah, dogs are susceptible to that. Thankfully, if your dog has it, they can't spread it to you, but they do get those illnesses.
Okay.
I wanted to touch on the tick piece if I could. Years ago, the only time that we got Lyme disease and we would do the investigations of them, people had travel associated with them. Well, there's been that shift now where they're getting locally acquired Lyme disease in Ohio. So that has piqued our interest. We'll continue to see tick-borne diseases. That graph will continue to climb. And that's been evident, like Sarah said, and when we look to the east in Pennsylvania and Connecticut, it's kind of like no stopping it. So we're, I think, on the cusp of a lot of different things and seeing a lot of different species that are coming into our area. And it's a concern at the state level. It's a concern at our level, and we're trying to do what we can with our resources to at least establish what our populations are, what we're seeing. And the big thing is education at this point, is really try and educate people deeply on mosquitoes and ticks. So when you're out and about, certain times of the year, the ticks are more active. And, you know, we always get more complaints in the spring. And I think that's when there's a lot of activity and from the ticks. And there's some cycles within their life cycles. So I'm glad she mentioned the fact that fall is also a big time for transmission of Lyme disease. People don't think of that, but it is.
And do you think that's mostly just due to our winters have been somewhat mild the last few years? Does that allow them to live and make it through the winter without having extremely cold weeks or several days of sub-zero temperature? Does that impact them or not so much?
I think it's impacted some of the southern species that are moving up, like the Lone Star tick and the Gulf Coast tick. The deer tick is actually very hardy. They've been kind of migrating down from New England, where we have very harsh winters. I think it's more so when they're adults, they attach to deer a lot and they'll actually mate on the host. So when we have a lot of deer in the area, which the deer population has just been growing as I think, we don't have natural predators. We are seeing less hunters, more habitat for deers. I think that's part of why we're seeing that population explode. And sometimes those wildlife dynamics, because rodents play a part in this too, sometimes those are affected by warmer winters and climate change too. Ticks are very sturdy. They can actually survive underwater for multiple weeks. They can, survive cold temperatures pretty much as long as it's above freezing. They'll be out and looking. Your ticks, they'll be out and looking for host. So I think it definitely is linked to climate change. It's just a little more not as direct, just as the ticks aren't dying in the winter.
Okay. Thank you.
Sorry, that was a long answer.
No, that's good.
That's good. I really appreciate the presentation on mosquitoes. This is a lot of things that I had no idea about. But one thing I thought about, I know that because of the quarantine and people being home, gardening and sustainability within the house and so forth has really shifted. There's national shortage of canning jars and lids because of people's changes in habits. But I know that it was really hard to find a rain barrel. There's a lot of brand new rain barrels everywhere. And I think in the spring, it would be really helpful to have some of this information that we can push out to people who are just new to the idea of having the rain barrels or the gardening in the yards and so forth.
We'll actually come out and treat rain barrels too, with a long-acting product, because unfortunately a lot of them aren't, they're designed to keep out mosquitoes. You still get mosquitoes breeding in there. That's included as part of the service you pay for. So I think we have been thinking about this, pushing out the education more, and maybe having so we have a request for service form that people can fill out. I was wondering if having a separate, hey, please come treat my rain barrel form, if that would maybe catch more of those people who have rain barrels and bring more attention to it, and allow us to kind of prevent the mosquitoes in the first place instead of
I didn't know that service was an option, and I feel like the climate we're in right now, people, it's just it's a new thing for a lot of people.
Yeah, and I should mention those Asian tiger mosquitoes, which we did see a good number in Grandview and throughout the county. They really kind of drive those complaints because they are just so aggressive and pesky. They're newer to the area. They've only been here the past decade. So I think a lot of people who are used to being able to have, bird baths and not think about it, these mosquitoes are moving in and people just aren't used to those habits of dumping these things, and it just, it can really cause a lot of misery, and people just aren't used to that. It's changing, they're not used to getting bit by a ton of mosquitoes in their backyard in the middle of the day. So they're not used to those habits.
Yeah, I just want to follow up on the rain barrels. That was such a big push 5 to 6 years ago with Franklin Soil and Water. It was part of a staple of their spring was to push rain barrels. Columbus's Green Spot program, the whole thing. We brought to their attention that these are massive breeders, that there aren't many designs that mosquitoes can't get into and lay eggs. You have to usually alter them some way to make sure that they're mosquito proof. So we've toyed with different campaigns to try and do that, and I think we're going to try and revisit that. We had an incident this summer where this particular resident, not in Grandview, but was complaining so much about mosquitoes. When she finally let us on the property, we lifted up the rain barrel and just got inundated with mosquitoes flying off. So, you know, they think they're sealed, but what happens lots of times is if the larvae are up in the gutters and you get a rain, it washes the larvae down into the rain barrel, and now you've provided a nice little incubator for it.
Mm-hmm.
So there's many different ways they can get in, and that's the last thing we want to do is create more conditions and problems for everybody. So if you've got more insight on how we can do that, please forward some ideas to try and get that. We've done rain barrel education in different formats for the last 3 to 5 years, and we're just still not there yet. Trying to capture all that. Thank you for that.
Yeah, very informative. Thank you. Anything else regarding the presentation? Anybody have any other comments, questions?
I do have. I'm curious why there is there ever a trap down at Wyman Woods? Because that's the part of Grandview that if it rains for more than an hour, that the whole area is flooded. So I guess I'm not surprised that you found an increase across the street at the gardens because just proximity.
Yeah, I don't think I set one at Wyman Wood just because it was so close at the community garden. But that is definitely something that we can look at more in the future. I mean, I think before we were just kind of focused on having our traps kind of central, but if that's not capturing the problem areas, I think we need to look at that. But yeah, that is definitely something that we can try, setting some extra traps and seeing what's going on in the city. And we can also kind of keep that on our radar or add to we have historical sites that we go and inspect on a weekly or bi-weekly basis where we know hold water. And we can actually add that on and add that to our treatment schedule for herbicides. Making a note, Wyman.
Okay. If that's it, I think the next item on the agenda is the contract with Franklin County. I looked through it, and being pretty much similar as the previous years, I don't see any issue of not recommending that to be approved by City Council and the mayor. Anybody have any questions or comments regarding the contract?
Actually, I do have a comment about the contract. I moved something here. Just want to reiterate what the chair is talking about. Over the years, the contract is essentially what we've been done every year in the past. The city will feel that there's no changes to the scope, no need to change the scope of the services right now. For the board, there's no additional services that we're going to be adding to it. And then we feel what's being offered is comprehensive for what the city needs. And we are very happy with the Franklin County services. And we appreciate the partnership with the Franklin County Public Health. They've been very supportive and helpful with many of our needs through the years. So I just want to give that information to the board.
Charlie, do you remember? I tried to find my old contract. For some reason, I remember last year it was 60. I don't know if I have 64 or 68 sticks in my head or somewhere around in there. Do you have any idea of where that was last year compared to what it is this year?
I think it was in the similar range. Joe can tell us the percentage change from last year.
Yeah, from last year's to this year for 2021, it'll be a 3% increase from year to year. So, our Board of Health, really wanted to be very mindful of certainly all cities and kind of the economic realities that we're all facing as local government agencies. So we were obviously with some increased costs able to keep that percentage down to 3% this year. I think and I appreciate the comments there, but what I wanted to maybe just offer is, and I think what you saw here in this presentation tonight, is that we're always looking for ways and opportunities to make sure that we're being even more responsive to the communities that we serve. And so, though the general scope of the contract hasn't changed in terms of providing the core public health services relative to licensure, enforcement, epidemiology, communications, and so forth. We're looking for more ways to bring in additional programs and services through grant dollars and other partnerships at of course no expense to our local municipalities. So that as a strategic priority for us, we're trying to find more opportunities to do that. And one of the things that we've been able to secure is the CDC dollars for opioid overdoses. We're trying to find additional funding for tobacco prevention and cessation, looking at more funding opportunities for immunizations as well. So, but overall, it's a 3% increase to cover some additional expected administrative costs over the next year. Our staff has grown over the last year as well, but we hope that's an acceptable rate increase given again the terms of the contract and our again our wanting to continue to improve our services as well as to expand them as well.
Yeah, again, I don't think anyone took it this way, but I wasn't asking about the increase in regards of having a problem with, because I know also that it increases per.
Has joined the meeting.
So the price, I know per capita may have gone up 3%. For some reason, I remember it going up a little bit more than that, but I still think what you guys do is a great job, and I don't see any issues with it or any concerns that would prevent it from being passed along to the city council and the mayor to be approved. Anyone have any concerns with that? I'll move to approve. Any all in favor say aye.
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 Opposed? Okay, that will be approved and moved on to city council and the mayor. Sorry, let me look at the agenda. I think that may have been one of the last items. Couple other items. And Megan, we did get the minutes approved, right? You did that early on.
Yes, we're good.
That's all. Okay, didn't have anything else that. Anybody have, I know from the last meeting to carry forward the vaping discussion and then the flu shot availability? I know both those were discussed during the last meeting. Anything to add, or Joe, do you have anything additional as far as the location and flu shot availability?
We do have our immunization clinic did open after it being closed for the better part of the spring and summer. We are open now 4 days a week, and we're taking appointments for immunizations, including flu shots. I'll put a link in the chat feature here for your reference. And so those clinics have been fairly full, as you would imagine. So really making an emphasis to make sure that we're getting kids back to make sure that they're up to date on their vaccinations, but then also we're making a major push on flu vaccinations as well. So let me put that link in the chat, and any way that we can help promote that message within the city of Grandview Heights, let me know. We're happy to try to do that.
Okay, thank you.
In regards to vaping,
Yep.
we had the program plan for the end of March, and that didn't happen. Sorry, my son's getting dropped off. and the dog's excited to see him. And so we had the program planned for March. Sorry, thank you, Mara. We had the program planned for March, and it didn't happen because it was after the quarantine was initiated and so forth. I know that the two women from the College of Public Health at OSU are more than happy to help facilitate something online, but we just haven't pushed it at all, or we haven't pursued it because we are talking that most parents or most people are exhausted with online format things. But if you going into the winter and so forth, if it's something that we are interested in, I know that they would put together some format where we can have some information for parents to understand vaping and so forth.
Thinking of that, I wonder how we would judge interest and attendance to see. I know people are interested. I just, like you said, I think people are so sick of the computer right now. It might be a tough audience to capture, especially as we move into the holidays and things. It might be worthwhile to get some items or literature that we could have available and push out to people. Because I know with kids being home and things, I know there's been a lot of discussion, obviously, about stress and depression and mental disorders and all those things. And that the nicotine or the use of other substances would go up during those times. So it might be worthwhile if they had anything they think would be beneficial to have that we could push out. It might be good at this time, and then kind of consider maybe after the first of the year.
Revisiting that.
Yeah.
Okay. I was also thinking, while Sarah was talking, I think she logged out. I really appreciate that presentation. I'm a biology professor, so I'm always up for a good lecture. And I did learn quite a bit of information listening to that. But
Yeah, I agree.
we keep having the same conversation about what we're doing as a board, and I think that maybe we should think about having a select day during the week where the social media, the Grandview Heights social media, there's some really great infographics that are on the Franklin County Public Health page, and I don't feel like we're doing a good job of getting that information out to our residents. So, and I'm happy to help coordinate that aspect where every Tuesday is Public Health Day in Grandview, and there's something relevant to the time that we're sending out. So this week we need to be sending out stuff about trick or treating. Going into the spring, we could say, hey, those water reserves rain barrels, name left me. Best breeder in town for mosquitoes. I think there's little things that we're not doing as a board that makes us more impactful. And that would be a simple thing that we could start doing. So,
Yeah, I think it's a great idea. To have something. And where would you? What are you thinking about as far as being able to get those items in front of the public? Have you thought that far about where and how?
Using the social media aspects of the city is the way to start. And maybe, like you said, I know there's brochures and so forth that we can get from Joe, and we could say, if you want more information, you either push them to the website or stop by the town council and pick up literature. Just some of those little types of things that we could be doing better. I know that there's a large population not on social media, and that we have the website where we can be putting some of that too, the city website.
Yeah, I think it's good.
Megan, is there one person who's officially in charge of the Facebook page and so forth?
I'll have to talk to administration or see who handles what.
Okay.
When it comes to the city website.
Okay.
Yeah,
because I
can get more information, but I'd have to look into it for you.
Okay. I'd be happy to have sort of a set schedule that every Monday I'll send you something, and on Tuesday it goes out and out. It can be, obviously I'm not going to type anything up that the board in general doesn't approve. So I can send some short blurbs of things that are relevant to the time. In a couple weeks, it can be Thanksgiving related.
Yeah, let me follow up on that and then I'll get a response for you.
Okay.
I don't know. I'm definitely not trying to complicate things. I don't know if any of that stuff would have to actually be approved through the board. I don't see anyone, and that's the complication with doing something like that. I don't know with all the rules and regulations. I would be totally fine with you sending stuff, to the city website. I think we probably just need to figure out exactly how and what we need to do to make that happen. It seems like a fairly simple process, but I think as we've learned the last 6 months, simple doesn't necessarily always exist when you're dealing with the governance and all those things of the city.
Yeah, I feel like we're underutilizing Joe's service to some extent. We
Oh,
hear
yeah.
things, but it doesn't always go broader. And,
Right.
And they're like,
No, again, I'm fully in support of doing that. So I think I can contact Joelle
okay.
and see kind of, I don't know if there's anything, maybe we don't have to do anything. Maybe we can just send it out. If it's something that obviously we saw at a meeting today, we could say, yeah, absolutely, send that
Right.
information out. We typically would only meet once a quarter, and that's where I think that would be difficult to put that stuff on a timely manner if we don't have another fashion. And we can meet more frequently, obviously, but that'd be the only drawback I would see with that. But hopefully that's not required.
Mhm.
And you are able just to send out the information to the city and have them post it. Because I would think somebody not a member of the board would be able to send something to the city and it'd be pushed out if the city thought was pertinent. So I don't know why the board would be privy to any additional items if you're not seeing it as, Jane Doe of the just being one, one of
Right.
the public.
And the other outlet we have, and we've talked about this before, if through the public alert system through the city, one option for you to select is the Board of Health. And so just, we could send the infographics that route as well, just to hit a broader. I mean, I will admit that between the election and COVID, I've sort of written off social media just because I can't handle it.
Right.
People I thought were smart aren't as smart as I thought. So I'm open to, the text alerts and so forth as well.
Okay. And I'm glad you brought that up because I don't know who it went to. I know it went to the entire board, but with do you have any more with that, Tessa, before we kind of move on? Or I think it's a great idea.
That's all I had.
Yeah. No, I think it's great. I was and this is not an indictment or to cast any negative aspersions on anyone. The Board of Health is this is even the case with when Ray was the mayor, and so this has nothing to do with Greta personally. Greta and I are friends. So what I had just questioned the necessity of the board, and is there any reason for us to exist? We've brought up a lot of ideas and everything. It's kind of been met with, well, we need to do this, we need to do that, or and in the Greta's email, she said, we're simply an advisory committee, and I understand that, but I was questioning just the necessity or even the purpose of having the board if it was even necessary for the city due to our size, the way it's governed. And I think if, with your idea, I think that would be a well worthwhile thing to do. But I was thinking, just through the whole pandemic, there being in the capital city, you have so many experts like Joe and the whole you have Columbus Public Health and Franklin County Public Health, and you know, the lack of communication with the board. You know, I just wondered if it, and again, nothing against Greta, she had experts that she could rely on. I'm not saying she was making any decisions in a vacuum, but I was just questioning whether it was actually necessary to continue having a board.
Like Mitt, Chair, the charter does require that board, and it would take a process to change that. I would make a suggestion that actually this board is kind of developing something here. And when I look at our agenda, one thing that we probably didn't do in the past was this other business. And I think that if, you know, we set our meetings up and the members have items like the vaping discussion, the rats, rain barrels, those can be put into that agenda, and we could ask Joe's group to do just what they did today and provide us the discussion or the information and the link and those kind of things. In terms of the website, you know, we do have a Board of Health link in there. That specific topic could be on the website, available for the public in relationship to the agenda timing. But, you know, we would want to link it to the Franklin County's information. We're not, as a city, going to produce that information. I don't know if that's of any interest to the board.
Yeah, I think
To, you know, we're all saying, well, why do we need a board? What's the purpose of the board? But I think when you have discussions like the vaping and those kind of things, those are hot topics that the board is aware of and maybe the residents are aware of.
I like that idea. I feel like we could do more. There needs to be a purpose to getting together and having these meetings, and
Sure.
adding to the website, pushing the information in a better manner than we're doing now is really important.
One of our problems, and I don't want to say it's a problem, is that we've contracted with Franklin County to do the major majority of the stuff. But by charter, we still have the Board of Health. And it's not for me to say whether that's good or bad, but based on the change of the board makeup, you know, I see there's a desire to move some things and make people more aware. And I think what I just suggested would help that process. You know, maybe, you know, if we schedule the next meeting, and I'd say the meeting's usually the fourth Thursday of the month, you know, prior to, you know, like, let's say January 1st, we would get the items that the board would like to consider, and we can pass those on to Joe Mazzola's group, and then put that on the agenda for that meeting. At least there'll be some time for them to prepare.
I think that's a great idea.
Yeah, for what it's worth, I do too.
And at some point, I do want to revisit pre-COVID. We started having conversations about, and I think you called them tracks, but sort of focused pathways of education. And and COVID hit and that fell apart. But I do think that's something else we should revisit. And I would leave it to your judgment right now as to when that is when that's appropriate. I think everybody is sort of overwhelmed with the pandemic at the moment, but there are other health concerns that we need to, you know, ease back into the mainstream conversations. And yeah, I don't know when that should happen, and I would understand if your job is not overwhelmed, but you have a lot going on your plate right now with just the virus that's being passed. So adding something else may need to wait a little bit.
Yeah, the other thing to remember is, as the Chair Harville pointed out, typically in the past, we only met maybe 3 times a year.
Right.
You know, that allows some time to prepare.
Right.
Yeah, but like you were saying, you know, that's not mandated. That's just kind of what we had done without any pressing issues. And obviously, we've seen this year that can be changed. So I think, you know, if there definitely if there's items that come up that we'd want to meet sooner, we can definitely petition, you know, the city or put something out to Megan to say, hey, can we have a meeting and, you know, on the fourth Tuesday or the fourth Thursday rather. I think on any month like we did this month.
Sure. With that, you know, I would recommend having the next meeting January 28th, 2021, unless Joe's group can see a need to really get back at us and have something in November or December. You know, something that's really drastically changed with the COVID.
The fourth Thursday of November is actually Thanksgiving. So
Right.
we are hitting a holiday with
Yeah, I don't know if we're winding up the meeting. If that's the case, we can definitely look at calendars and see where those dates fall. And yeah, the fourth Thursday in December is Christmas Eve anyway. So I would say the 21st of January would be a good
January
proposed date. What's that?
It'll be January 28th.
Oh, I'm sorry. Yes, the 28th. Correct.
Yes, that's right. Just double check.
Yeah. All right, so we will set the next meeting for January 28th at 7 o'clock.
Sounds
Unless
great.
this is us, and if Joe, if you miss us enough, I would be willing to meet with you late on Thanksgiving night or even Christmas Eve. I'm sure my family would enjoy hearing everything you have to discuss. I'm sure your family would be
I'm
very
sure that
happy
they
with your
would.
decision. You know, it's very important part of Grandview, as we are, you know, special folks. But if you have something better to do, I fully understand. I won't hold that against you.
That might go against what I was talking about earlier with gatherings and so forth, but I may make an exception though for that.
Well, maybe we can make a family meeting. We can all be around the computer, you know, have a fire in the background.
That sounds great.
All right, so the next meeting date will be January 28th at 7 o'clock, wherever you are at that time. Is there any additional business that we want to add? I would say, Megan, if you'd like to add Tessa's point of getting agenda items to either Franklin County or the website. I think additionally things to put on the agenda for next time are, again, the idea about come spring, something about the rain barrels and the mosquitoes. And
the rats.
What's that?
And the rats.
Yeah, and the rats. Yes, whatever we can do. I think we put that on the agenda item for January to make sure we just don't forget about it and to make sure that we can even have the city maybe put something. When does that flyer come out, Charlie, that the city puts out? They put out, was it a fall, winter one, and then?
Oh, yeah, we would have
do
to
it
work
quarterly
that
now.
administration.
What's that?
Yeah, they do put one out. We'd have to go through administration to find out when it exactly comes out.
So I don't know when that goes to print, but I think if that's coming out in in January, let's say, or February, having something about the mosquitoes in that one, or that and the spring one, I think would be a good idea. And maybe even some of the information we could put in there to gather from what Sarah and the other Charlie had on as far as that mosquito program and how that works and some of the chemicals that they use to inform people about, you know, the safety and the process, and just some very bolded points about, you know, the Asian tiger mosquito that comes out in the, you know, in the evening, it's more aggressive and different things. Just, I think some bullet points from that presentation, which again was very good, could be put in there to let the citizens know kind of what that is, and maybe it would change the people's mind about letting them spray, so we don't have, full streets or multiple blocks that are in red where, because our houses are so close together. To be put on that spring flyer or the winter flyer, whichever one or both.
Okay, so I would recommend that for the January meeting, if you could get the topics that you think you guys want to talk about to us by January, the beginning of January, so January 2, so that we can put them on the agenda.
And then the last thing is I copied and pasted the link that Joe sent earlier about Halloween. If we could get something, if that could be pushed to the website now, just so it's out there, and then we can all post to Facebook and wherever we are, because we have about a week and a half, I think, until that happens.
Right.
So that's on next Saturday night. I believe the 31st. I don't have a calendar in front of me. Yeah. So I don't know, Charlie, if I need to call someone about having that put on the website or that link, or if I send it to Megan, if it can be put out.
The Halloween one, I would send to Megan, and we'll get it to administration.
Okay.
I
Yeah.
actually have both. I have the two infographics that are on the website, on Franklin County website pulled up. So Megan, I'll send you an email now. And if there's somebody in the future that you want me to send things to directly so that you don't have to be a go-between, let us know who that is, and I'm happy to send things to them.
Okay, we'll have to figure this out because, the chain of command kind of thing.
Thank you for sending that out, Tessa.
I'll send the two Halloween specific ones now.
So you're going to send the one about the Halloween, and what's the other one?
There's actually two different Halloween ones. There's
okay.
a Safe Halloween, and then there's a 2020. So it's there's advice for trick-or-treaters and advice for treat givers.
Okay, perfect.
And the other one, I think it's more general, walk and make sure you can look for your mask and so forth.
Okay.
See through.
I just want to comment that, these are from the Franklin County site?
Yes.
Okay, all right. Because they'll review them, meaning administrative staff will review them, and if they want to, if there's changes or stuff, they may ask to do that.
Okay.
I'm assuming there wouldn't be, but just in case.
Anything else?
No.
All right. I think great contributions from everyone. Tessa, some great ideas. I really think that's exciting and something to definitely move forward with. If that is it, I will say everybody enjoy their Halloween, Thanksgiving, Christmas, we choose to celebrate, and I will move to adjourn the meeting.
Have a good evening.
Thank you.
Thank you. Have a good night.
Good
Thank
night.
you. Good night.